Just want to say hello to everyone and thank you for coming from all over the planet to bring hope and inspiration in particularly chaotic times with pandemic health concerns. I want to share good news from scientific research and application benefit that has come from the completion of the Human Genome Project and gene-wide association studies all over the globe. From a study titled, "The Future is Now, Precision Genomic Addiction Medicine is and will be a frontline modality for inducing dopamine homeostasis in reward deficiency syndrome." This is published in the current pharmaceutical biotechnology found on PubMed. Some of the highlight topics are genetic variants, neurobiological challenge, genomic intervention, and the new concept, reward deficiency syndrome treatment plans. These can be complicated, confusing terms, especially for people who work in other fields. Gene variances are mutations or variances that are inherited from your parents. Epigenetic influences come from environmental and experiential causal influences. So genetic predisposition for this crowd of people in the center group, it refers to an increased chance or likelihood that an individual person will develop a specific disease based on their genetic makeup. In the United States, the National Institutes of Health and other associated with the World Health Organization have sent out directives that focus be directed at neurobiological causation across the span of disease. And in mental health and addiction science, this has revolutionized understanding, improved diagnostic ability, and given us viable application to treat the cause. And the most predominant neurobiological challenge facing human beings and families through generations is called dopamine dysfunction syndrome. Now, that's a confusing term and a lot of words that might leave us confused, but in a very simplistic explanation, it means that the shortage or deficiency of the neurotransmitter dopamine affects overall neurological balance in your brain. And the neurogenetic influences have been highlighted by advances in neuroscience in large perspective and redirect last century's 12-step focus away from the symptom of self-medicating to address hold with me one moment here to address the actual underlying neurobiological cause of mental health disorders. Mental disorders are really brain disorders, and personalized treatment plans are required using genetic screening for genomic intervention. So we add the neurogenetic and the neurobiological. We can conceive of the largesse of the neuroscience of addiction. In this era of genomic medicine, psychiatric and psychological genomics are leading the addiction and mental health fields with enlarged perspective and new applications. So there's hope. There's hope for the individual suffering and the families. And there's hope for the community at large. Each of these disorders on the sides of this page, beginning with substance use, all of the drug addictions, alcohol, cocaine, heroin, nicotine, stimulants, cannabis, sedatives, hypnotics, caffeine, sugar, and glucose. Plus the behavioral process addictions of gambling, gaming, sexual, eating disorders, thrill seeking, and risk taking. These substance addictions and behavioral addictions all have common underlying neurobiology. On the right, we include a list of mental health disorders such as the impulse disorders, attention deficit disorder, hyperactivity disorder, Asperger, autism, Tourette's. Each and every one of these have something in common. They have an underlying dopamine deficiency. Included also in the reward deficiency syndrome spectrum is depression, the full depression spectrum, obsessive compulsive disorders, post-traumatic stress disorder, obesity, and Parkinson's. So that's a lot to try to grasp. Beginning my studies, I was focused on substance use disorders and mental health disorders, only to find that they are symptoms of a larger problem, a problem which begins early in life, beginning with birth and your genetic profile, and continuing until your death, end of life. But at least that this new information has directed focus so that we can treat the correct problem. We can treat the cause, not just the symptoms. Imagine the difference that this can make in someone's life. Instead of having to repeat treatment over and over and over again without success, there's viable evidence to show that this intervention can stabilize brains and help people regain control of their mind and their life. In the future, primary care physicians will be looking for this in their offices when they treat children. They will propose a genetic screening to test for certain variances that we know contribute to genetic addiction risk severity and all of its many manifestations. They may refer you to genomic psychiatrists or neuropsychologists who can administer RDS psychoeducation and solution-focused brief interventions. These are currently available through L Resource and have been researched through L Foundation Research Study. The 200 series is currently recruiting participants who would have been called dual diagnosis in the last century, meaning that they would have a substance use disorder or a behavioral addiction of some kind, plus a mental health diagnosis. That's a little bit out of date, the conceptualization. Today we look for, or we refer to mental health clusters, meaning those mental health diagnoses which share dopamine deficiency, or another group which may share an excess of dopamine. And so the direction this is going in is neurological or neuro problems in neurotransmission underlie mental health disorders, neurological disorders, developmental disorders that affect you over the lifespan. We want to recommend genetic screening for all children, especially children, adults, addicts, and families with mental health disorders as prevention for future disease development, for progression of Reward Deficiency Syndrome or RDS, because it wears a different face than just substance abuse. It may wear the face of obesity and depression. You can find resources to that on lresource.com, and they're free. Okay, so the revolution in genomic precision medicine is that it's personalized. No more one size fits all. This is personalized medicine tailored to treat the individual's unique circumstance, which means their genetic variances, their neurological imbalances, their different personalities, their life experiences, and to re-examine any prior diagnoses. We want to attune the diagnostic process. And with the contributions of global scientists, this is literally possible now. We don't have to, we might have to wait for the future to have access to it, but it's literally happening right now. Precision genomic addiction medicine. It begins with a gene test. We'll swab the inside of your cheek and have that tested in a lab. The results will be analyzed for neurological issues, and then an exact nutraceutical and or pharmaceutical response intervention specifically for your genome, your specific genes, is created. So it's created for your brain specifically. With the right medications, which is the elimination of trial and error, of prescriptions, try this one, try that one. Neurological stability is achieved. It's called dopamine homeostasis. Okay, quickly. An entire science has been put together by lots of different scientists around the planet, from Dr. Kenneth Bloom's team. And we're actually helping people, bringing it to people. These are neuroscientists. I'm a psychologist. So what I do is interpret and create a bridge And I called it psychological genomics to access the therapist and the patients to help bring in the miracles of their research. Okay, so to begin with, we'll have to explain what this all means because the world has been viewing substance use or addictions through a lens or a pair of glasses of the 1950s Minnesota model, the 12-step model. And so we need to provide a new pair of glasses for patients and practitioners to conceive of a new paradigm that will be called the RDS paradigm. Test measurements have been created. The RDS Q29 is a very simple, very quick test, which will indicate if there's a need for further investigation. And if there's not, there's no reason to spend the money for this process. The result of what we hope to achieve by this and what we do achieve is dopamine homeostasis. So you help a person whose brain condition is dopamine imbalance, a non-functioning or dysfunctioning dopamine channel, and you put it back into homeostasis. All right. Now, there's a therapy created that we can teach to therapists so that they can teach it to patients. It's called RDS Solution Focused Brief Intervention. It explains how this process works. And this is not instead of inpatient treatment, it's in addition to. We're conceiving of the 12-step treatment now as detox because it doesn't treat the cause. It helps stabilize the patient and get them ready for a phase 2 genomic intervention. And I created the RDS SOS. I use it every day. It's a self response investigative tool. I just check off how bad or how severe my symptoms are. And there are physical symptoms and psychological symptoms and neurological symptoms, which help me better manage my condition so that I maintain dopamine homeostasis. It's not enough to get into dopamine homeostasis. You have to be able to maintain it. And this helps the individual patient invest in their own recovery so that they're not always just relying on their doctor. Okay, so once a person has detoxed and their brains are stable, I want to move on to psychotherapy for pathology. This would be your behavioral modification therapies, some of your cognitive therapies, which help you to identify errors in your thinking and ways to interrupt patterns which are maladaptive. And it puts the therapist and the patient together as team members. So with the detoxification from traditional treatment, which is available now, when you add the applications from neuroscience called genomic addiction medicine, we can help bring the individual up to the level of 0. So we've addressed the pathology. Now there's time for improvement, for thriving, for wellness and self-actualization so that they may be restored or for the first time become a contributing member of society. So with health problems that are affecting nations, communities, families, individuals, this is a system which brings us hope to elevate humanity. Here, this slide is the science of well-being. And from cultures all over the world, there are wellness practices that integrate mind, body, and spirit. Exercise, nutrition, music, singing, drumming, dance, nature, laughter, fellowship. These help bring us into the moment, attune us in the collective. Prayer, rest, relaxation, massage, affirmation, kindness, gratitude, forgiveness increases connection within the species, within our collective consciousness. So I am a big believer of yoga, acupuncture, Reiki. All right. So that was briefly an outline of what progress genomics um, can bring. But let's talk from the heart here. Okay. We have to have rules and regulations. And in some countries, possession will lead to a lifetime of incarceration, imprisonment, all of the problematic social issues that cost us our resources, our money. And this population, typically the dually diagnosed, those mentally ill, have not fared very well, have not benefited, and treatment hasn't worked, even though you've run them back through several times. So it's easier just to send them to an institution or to imprison them. It is. It's a better use of the resources, logically. But speaking from the heart, what would you do if it were your child, someone you love? Well, if you're like me and you're like my father, you would go to the ends of the world to try to help. Children who become teenagers or young adults who begin using drugs have some commonalities. Most of them have endured violence, attack, assault, sexual assaults, emotional assaults, have not learned to love themselves or to value themselves. And sometimes psychiatric fracture is so severe that it does damage that they may never come back from. The very tip of the iceberg looks like drug abuse. And each time a wounded child of a wounded parent, goes through treatment and leaves temporarily clean, only to relapse again, it just heightens the problem. So I want to tell you what that feels like on the inside. A person usually wonders, why didn't 12-step treatment work the first time, the second time, the 10th time? Will my suffering ever stop? Will I ever feel okay? Will the chronic abstinence symptoms, the pain, the anxiety, the craving, the impulsivity, the suffering ever stop? Will I ever be okay? Will I ever be happy or feel loved? When will I stop being so mad, so sad, so depressed? When will these mood swings and racing thoughts go away? Call this the war within. That's what addicts feel. Mental health patients feel as they sit on the outside, isolated and separated and rejected from their families, from their cultures, even from their own selves. I want to tell you that there's a common phrase that I've heard our research participants say when they get into dopamine homeostasis. They say it is bliss. It is bliss because they're not suffering anymore. Okay, this timeline gets us into the complexities of what RDS is. Now, it shows in early childhood. It looks like children who may be developmentally delayed. They may have speech problems or language problems, may have attention deficit hyperactivity disorder. It may show up as Asperger or autism. This is an immediate red flag that these children have reward deficiency syndrome genetic variances. You know, we could do a gene screen and test for that and have the evidence in front of us, or we can look at these symptoms and say, yep, okay. And so what we know is that over the course of a lifetime, what's going to happen with a high probability? Certainly, there's going to be a lower quality of life over the lifespan. As these children age, some of them may experience some sort of normality, or it could get worse. It could start showing up as social or emotional delays, which happen in their relationships with their schoolmates or their teachers. They may not fit in. They may start drinking and drugging. With girls, especially, image distortion and body distortions may lead to eating disorders. And often there are impulse control issues. A more severe form would be conduct issues. Okay, by the time they're in adulthood, you're going to see mental health disorder clusters pop up as perhaps bipolar or drug abuse. And what is happening neurologically is the increasing devastation to the brain and the body collective from too little dopamine over time, and the changes in the brain that occur based upon our attempts to self-medicate. So what we live into existence, the experiential variables, we can make it worse. And this is called epigenetic insult, when our brain needs to overcorrect for the problems in our behaviors, which makes it even more complex because then you have genetic as well as epigenetic issues to be concerned with. By the time you're in old age, this looks like movement disorders, inability to walk, to stand, to feel good, to keep an even gait. You're aging more rapidly, more so on the inside than is shown on the outside. There's cognitive decline and ultimately Parkinson's, Alzheimer's, and the breakdown of the brain leads to premature death. So I'm not trying to be dramatic here. This is just what science has shown us, but at least now we know what we're looking for and what the problem is. So instead of trying to focus on just treating substance use addiction with 12-step behaviors, we know to come over here in early childhood and do genetic screening so we can look at the neurological issues and address them with nutrition rather than pharmaceutical drugs. Okay, my mission since in founding the L Foundation, and our first project, the Dragon Slayers and Bridge Builder Ministry, is to stop the cycle. Now, that seems rather grandiose, doesn't it, to even think that that's possible? And sometimes it seems, how is it even possible? Excuse me. We had in America over 100,000 died this year alone from opioid addictions. Oh, how do we stop this from happening in the lives of the children? Well, refocus. We're doing more research. So we're looking into, hold on just a moment. I might have skipped a slide. No, okay. All right. We're trying to help. Although the science has been created over 60 years with these incredible scientists, it's not yet available for purchase to people. There's a business has not been created around it that is viable. It's not in the hands of doctors and practitioners who are treating patients. In fact, they're not even aware of it, and they haven't been trained in providing genomic medicine. And this is not just in the field of addiction and mental health, it's in the field of every field of medicine. The new standard is genomic medicine. Do genetics consider genetics for a genomic response? So we're continuing to help one patient, one family at a time through case study. And I'm encouraged. And as long as I have energy for a while, I'll be doing this. And our website or this telephone number, I'm happy to provide references to refer you to someone working in some kind of area that might help you. There are teleconferencings, meetings, and opportunities that are being created. So if you live in Singapore and I live in Florida, we can still communicate. So I would like to thank the team. I am the student who has been mentored by some incredible scientists. And this is this presentation has been based upon this study that we published, The Future Is Now, Precision Genomic Addiction Medicine as a Frontline Modality for Inducing, excuse me, dopamine homeostasis in Reward Deficiency Syndrome, which was published in Current Pharmaceutical Biotechnology and on PubMed. Thank you. So here are the professors: Dr. Biruat, Dr. Gupta, Dr. Giordano, Catherine Dennett, Eric Braverman, Dr. Rajana Badgayan, who received a 2024 Award for Excellence in Neuroscience from the L Foundation this year. Dr. Thomas McLaughlin, Dr. David Barron, and the incomparable Dr. Kenneth Bloom, who is the 2024 recipient of the Lifetime Achievement Award in neuroscience. I'm very happy, very grateful to be mentored by such esteemed colleagues. I hope you could understand me in my English, and if you have questions, I'm happy to help. I'll probably be here next year bringing you up to date on any new findings that there are. I thank you for your time, and I thank you for asking me. And that's it. I'm that's the end of my presentation.